Hello, everyone. We're here back at Pure on the round table, and it's Dr. Wegerif's turn. We're talking about the summer because it's coming up, and a lot of breast surgery patients are concerned about the scars. So, what do you do to minimize scars, and what's your approach to that?
So first of all, we want to think about choosing the right procedure for the right patient. Some patients are candidates for breast augmentation alone, which is always a very small incision in the fold of the breast. I believe you guys usually always use the fold of the breast as well. Some surgeons choose different locations to do that, but there's risk with capsular contracture when you're choosing different locations for that. In terms of breast lifts, there's a few different options for the breast lifts. We can go just around the areola for a select number of patients. Sometimes it's around the areola and down vertically. Sometimes we need to do all the incisions we need to tailor the skin to really reshape the breast, and that includes the fold of the breast, so around the areola down and along the fold of the breast. The good news is those scars hide really well in the fold of the breast and under what your bathing suit is covering. And that vertical scar really tends to blend and fade as time goes on, and it's really something that patients are oftentimes very concerned about, but once they've healed and recovered and they're a year out, those scars have faded. In my opinion, it's not something that I frequently get concerns about from patients with those scars. I don't know what you guys think.
Yeah, and I can talk from a very personal standpoint. I have a breast lift scar, and I use bathing suits like bikinis, right? So they're very well hidden in the fold around the areola, and the only one that most people are concerned is the vertical one, which is the one going down from the areola down to the fold. Usually that's the one that heals the best. So if you treat it very well with you're very diligent with your scar products, I recommend Silogen is great. You're very diligent with your scar treatments, and even adding IPL lasers to get that pigment out, and it fades so nicely that you sometimes you have to literally look in closely to see if it's there.
Since we're talking about it, if you're tanning in some beaches in South Florida or somewhere in France and you're tanning topless, make sure you're using sun protection, because that can lead to hyperpigmentation of your scars before they've matured completely.
Yeah, that's right. And I think when I think about scars, I think about four things in terms of how to improve the scar, right? So one of them is, of course, the technique. So surgeon technique is important. The next one is placement. So it's not just about, making the scar look good, but putting it in a place where it's going to be very easy to hide. And then, of course, then it's treatment. You have to treat the scars. You can't just leave it alone and hope for the best. And then the fourth one is something where we can't really do anything about. That's kind of just genetics, right? Some people are just genetically predisposed to a hypertrophic or keloid scar. And so all of those things combined is what's really going to create a great scar. And so it's just not one thing alone. It's not just about technique, but everything involved in order to create a well-hidden scar, especially when you're wearing a swimsuit out on the beach.
Agree.